I would like to spread change and awareness to all the women around us, and that by promoting a healthy lifestyle and early detection, that is very important to help prevent diseases. And I would love to promote healthy lifestyle and longevity, which are the two main pillars of the UAE benevolent leadership. It's very important for women to get screened for, say, example, breast cancer or ovarian cancer, and they should not be afraid, and prevention is better than cure. When I was young, I always knew that I wanted to be a doctor. I used to go with my mother to the clinic and see how she used to treat the patients. And I used to play with my brother and my friends this game called Operation, where we would remove the organs from the body. And so I had a feeling that I wanted to go into medicine, and that's what I did. And so my parents, my mother, my father, my elder brother, they were extremely supportive. And in fact, they helped me to do my surgical training abroad. I went to Canada, to the state of Vancouver, University of British Columbia, and that's where I spent 6 long years training to be a general surgeon.
Welcome everyone with your program Pills of Yunan, who invade the most successful study and person here in UAE. Today from Dubai City with Dr. Taghreed Almahmeed. Welcome, doctor.
Thank you. I'm very happy to be here.
Well, doctor, today we need to speak about your successful story. So from the beginning, we need to know more details about you to present you for everyone.
My name is Dr. Taghreed Almahmeed. I'm a consultant general and breast surgeon. I grew up in a family of doctors and pharmacists. My mother is a doctor, a pediatrician. My father is a pharmacist. And my elder brother is also a doctor. I was sponsored from the government of the United Arab Emirates. They were very kind enough to sponsor me to study my medicine abroad. And so I studied medicine in the Arabian Gulf University in Bahrain.
Any person needs some person who support, who help him. From your side and from your successful story, who helped you and support you?
Well, to begin with, after I finished medical school, I did a rotating internship in one of the hospitals in Bahrain, the Bahrain Defense Force Hospital, and my first rotation was actually in general surgery. And during that time, my boss, he walked me through a hernia operation. He held my hand and told me the steps. And when I finished the surgery, I was very excited, and that's when I knew that I definitely wanted to be a surgeon. So at that time, many people were against me, and they told me, no, you're a female, this is a man's world, and you should not go into surgery, choose any other specialty. But I was very adamant that this is what I wanted to do. So they are the ones who supported me, my parents and my brother, in this very long and challenging journey, and they were a constant inspiration for me. And with my resilience and perseverance, I was able to become a general surgeon, and my family, they lived and breathed the journey with me the whole way.
If I ask you now, doctor, about your challenge of life.
Well, my initial challenge was to get into medical school, but I did very well in my high school, and so I was able to get into medical school, and I did 7 long years of studying, and again with the support of my mother, who's a doctor, and my elder brother, because he had already studied medicine, so I had their support. But then, of course, the biggest challenge is when I decided to go into surgery, because I wasn't going to do it in my home country, but I left to go to Canada, which is halfway across the world. And I knew nobody over there, so I was alone without any friends or family. And it was a huge challenge to try to settle in there and get used to the system and get used to their ways. My 6 years in surgery were extremely challenging. I worked very long hours. There were nights when I was working 36 hours straight. That's when we were on call. We were expected to work 36 hours, and then we would just have a day off and then go back and work again. And so it was very, very exhausting. But I was determined to do it. And I wasn't going to give up, and I was going to show everyone that I can be a surgeon.
Doctor, you chose to come back for UAE before 6 years, so this time, what do you think about the medical system in UAE?
After I had very extensive training in Canada and the United States, I felt that I need to go back and help the people of the UAE, especially the women, being a female surgeon, because I know that they are very embarrassed sometimes to go to a male surgeon, and there are not many women out there that are actually female trained surgeons in this, in this field. So I came back to help the women of the UAE, and also because my family is here, and I wanted to be beside my family after many years of being away from them. The medical system has made astonishing advances over the years. With the support of the rulers and the leadership, they have built the infrastructure of the healthcare services in the United Arab Emirates. There are state-of-the-art hospitals and clinics with the most up-to-date equipment and latest innovations. The United Arab Emirates, they have created an infrastructure of healthcare services that are on par with international standards, and they have taken great strides in building their healthcare sector by partnership with many US companies.
Now, Doctor, UAE and Dubai especially, it will be like the best destination of medical tourism in the world.
Yes, we've become very popular for medical tourism. A lot of people now choose to come to Dubai to get treated from many different countries in the world, because the UAE has continued to attract and retain the top quality doctors, nurses, and technicians through their improving infrastructure and education. And so many people come here to get treated, not just because of the doctors, but also because of the, like I said earlier, state-of-the-art hospitals and equipment and all the latest innovations.
The technology, it will be in all sides of our life. So from your side, doctor, what do you think of using the technology in your specialty?
I did train in the robot when I was in the United States. Many patients get intrigued when you mention the name robot. So basically the idea is the patient is on the table and you are operating on them from far away. And it is a very nice procedure. It's minimally invasive and it doesn't take much time.
Doctor, if I ask you about the key of success from your side, what means?
For me, the word success means to help my patients in every way I can. So my aim in life is to restore the health, happiness, and hope of my patients, and to use every part of my expertise to nurture their care and to offer them responsible and consistent care and uphold the integrity of my clinical practice. I have many women who come to me, they have issues with their breast, for example, or they're obese, and they want me to help them. And I have operated on many women, when they come back to me and they are satisfied, that gives me a lot of happiness as well. And to me, that is the meaning of success.
Now we need from your side, doctor, a motivation message for the new generation of doctors.
I'd like to tell the new generation that being a doctor is a very, very noble profession, and it is a very difficult and long profession, but it is very important to help our people because they are in big need for our help, especially the women. We need more female doctors. And I would like to tell everyone that medicine is not just about making more money, or it's not just a business. It's a profession with a human touch, and you must not forget that. We are here to help our patients, to treat them and help them through their treatment journeys, and be always there to support them and to support the family.
It's time to take some words from your side, doctor, for all leaders of UAE.
I would really like to thank the rulers and the leadership of the United Arab Emirates for sponsoring me to study medicine abroad and general surgery and support me on my very long and challenging journey. And as I said before, I came back to the United Arab Emirates because I wanted to be with my family, and because I know that the leadership has really done its best to rapidly build the infrastructure of healthcare in this country. I came back and found that they have state-of-the-art hospitals and the latest equipment, and I feel no difference between the United States and here. And so I'm very proud to be back and very proud to help my people here.
So Dr. Taghreed Almahmeed, we are so happy to meet you today, like a great example of doctor. Thank you so much.
Thank you very much.
Thank you so much, everyone. See you next week with the Pearls of Program. Bye-bye.